Good afternoon. I'm Darlene Blaylock, and this is my community teaching project for Nursing 403 Community Health Nursing at Murray State University. Today I'm going to discuss influenza or the flu vaccine, who should and should not receive it, benefits, complications, and statistics of the flu vaccine, and finally, what you can do to stop the spread of the flu. As healthcare providers, our goals when it comes to the flu are to prevent the spread of the flu, educate the community about the flu, and increase vaccination rates among healthcare workers. The flu affects an estimated 5 to 15% of the world's population and results in 500,000 deaths annually. Why is it so widespread? Well, it's easily transmitted from person to person through air droplets. Even just a few minutes of casual contact with an infected individual can spread the illness. The flu vaccine is effective 70 to 90% of the time in healthy adults less than 65 years old when the vaccine is well matched to the circulating virus. 58% of the time in adults 60 years old and older, and 20 to 40% of the time in elderly patients in a hospital or nursing home setting. The flu vaccine is still the single most effective method to prevent the flu. It has been shown to decrease staff illness and absenteeism and is available through an injection or a nasal spray. It protects against 3 strains of the flu, types A, B, and H1N1, or the swine flu, which is a subtype of type A. After vaccination, it takes 2 weeks to develop immunity, and protection lasts several months to 1 year. The live attenuated influenza vaccine is available at our organization. It's a nasal spray approved for healthy people 2 to 49 years of age who are not pregnant. However, healthcare workers who receive this vaccine must avoid contact with immunocompromised patients for 7 days after vaccination. Who should get vaccinated? Healthcare workers and anyone at high risk of developing serious complications from the flu, older adults, pregnant women, very young children, and people with certain long-term conditions like diabetes or COPD. Who should not get vaccinated? Anyone with an allergy to the flu vaccine or any component of the vaccine. People with egg allergies. Anyone with a history of Guillain-Barré syndrome, which is a severe paralyzing illness, or anyone who's just not feeling well. Complications of the flu vaccine are generally mild and infrequent, but can include fever, muscle aches, Guillain-Barré syndrome, soreness, redness, or swelling at the site of the injection, headache, and fatigue. For those who can't receive the flu vaccine due to egg allergies, there's a new vaccine with a real original name that was FDA approved this past January. It's called Flu Block. It doesn't contain the mercury-containing preservative thimerosal, which the current flu vaccine does have. It's made without eggs, and its effectiveness rate is 44.6% against all circulating influenza strains. Healthy People 2020 objectives as related to the flu vaccine are to increase the percentage of children and adults who are vaccinated annually against seasonal flu to 80%, and to increase the percentage of healthcare personnel who are vaccinated annually to 90%. What is Healthy People? For those of you who don't know, Healthy People is a program of nationwide health promotion and disease prevention goals set by the United States Department of Health and Human Services. The goals were first set in 1979 for the following decade, and they're updated every decade. Healthy People provides nearly 600 science-based, 10-year national objectives for improving the health of all Americans, and is the result of a multi-year process that reflects input from a diverse group of individuals and organizations, such as the Administration of Aging, the Agency for Healthcare Research and Quality, the Centers for Disease Control and Prevention, or CDC, the Food and Drug Administration, and the National Institutes of Health. Nationally, between August 2011 and May 2012, 41.8% of all people 6 months of age and older received the flu vaccine. The vaccination rate among healthcare workers nationally in 2010 and 2011 was 63%. The state of Tennessee's vaccination rate between August 2011 and May 2012 of 47.3% surpassed the national rate, As you can see from this table, Tennessee has one of the highest vaccination rates in the nation. Henry County Medical Center's vaccination rate in 2012 and 2013 was 83%, both hospital-wide and in the emergency department. So what can you do to stop the spread of the flu? First of all, get vaccinated. Follow hand-washing protocol. Wear a mask when caring for those diagnosed with the flu, even if you've been vaccinated, and especially during the 2 weeks after you've been vaccinated before immunity develops. Avoid contact when possible with those infected with the flu. Finally, educate patients about the flu vaccine. How many of us have heard people say, "I've had the flu shot, I won't get sick," and take unnecessary risks? We as healthcare workers need to inform the community that the flu vaccine is still the single best way to prevent the flu, but because the effectiveness rates are what they are, everyone must still take other precautions to prevent the spread of the flu. Everyone, thank you for your time and participation in this teaching project. I really appreciate it. There's a post-test in the department that I'd like everyone to take and return to me. Again, I really appreciate your participation in this project. It means a lot. Okay, thanks so much.